Now we will discuss common complaint, that is a back pain. A lot of people come with a back pain, either upper back pain, middle back pain or lower back pain. We'll discuss about this condition. Pain in the back is a common concern, affecting up to 90% of the population at some point in their lifetime. That means almost everyone will suffer from the back pain sometime in their life. Up to 50% will have more than one episode. Low back pain is not a specific disease. Rather, it is a symptom that may occur from variety of different conditions. Back pain can have many underlying reasons. 90% people, even with a nerve root irritation, symptoms will improve within 2 months, no matter what treatment is used, even if no treatment is given. Lot of patients are confused about nerve root symptoms. They think all the pain in the back or leg is because of nerve pain, nerve problem. It is not so. Many times back pain is because of the spasm in the muscles of the lower back or neck muscles. Nerve root syndromes are those that produce symptoms of nerve impingement, often due to herniation of a disc between lower back bones. Sciatica, a common terminology, is an example of nerve root impingement. Impingement pain tends to be sharp, affecting a specific area. They have a radiating pain from back to the thigh or the leg or the foot, depending upon the nerve root involved. Quad equina syndrome is a medical emergency whereby a spinal cord is directly compressed. Disc material expands into spinal canal which compresses the nerves. A person would experience pain, possible loss of sensation, and bowel or bladder dysfunction. This could include inability to control urination or inability to begin urination. Other skeletal causes of back pain include osteomyelitis, infection of the bones, non-infectious inflammation of the spine like a spondylitis can cause stiffness and pain in the spine that is particularly worse in the morning. Tumors, possibly cancerous, can cause source of a skeletal pain. Majority of the times back pain subsides without or with the treatment. Sometimes you have to be very careful. In medical terminology, we call some of the signs of the back pain as a red flag signs. The Agency for Healthcare Research and Quality has identified 11 red flags that doctors look for when evaluating a person with a back pain. Focus of these red flags is to detect fractures, infections, tumors of the spine. Patients with the red flags should be referred to the concerned doctor immediately. The recent significant trauma, such as a fall from height or a motor vehicle accident. In such cases, if the person complains of back pain, then most probably he will have a fracture of the spine. Recent mild trauma in those older than 50 years of age. Older patients' bones will be weak, osteoporotic, that cause a fracture with a minor trauma. History of prolonged steroid use. Steroid use causes osteoporosis, and even a minor trauma or without trauma, these patients can have a compression fractures of the spine. Any persons older than 70 years of age, if he complains back pain, especially resting pain, then there is an increased incidence of cancer or infections or abdominal cause of pain. In older age, you should not neglect if they complain pain, especially resting back pain. Prior history of a cancer. If there is a history of cancer in the past, that indicates possibility of a spread of the cancer to the backbone. History of a recent infection. Temperature over 100 Fahrenheit. These two indicate possibility of a infection in the back. IV drug use. Drug abuse that causes the risk of a infection in the backbone. Low back pain, worse at rest. This is thought to be associated with the infectious or a malignant cause of pain. Unexplained weight loss. Weight loss is seen in cancers or chronic infections of the back. If there is a weight loss associated with the back pain, you should evaluate and the patient properly. Presence of any acute nerve dysfunction should also prompt an immediate visit to the orthopedic surgeon. Loss of bowel or bladder control, including difficulty in starting or stopping stream of urine or bladder incontinence, indicates there is a significant pressure in the spinal cord. Then you have to refer all these type of patients to orthopedic surgeon, and you should evaluate the patient properly and do the relevant investigations to rule out any serious diseases like infection or a tumor. Coming to the treatment. General recommendations are to resume normal or a near normal activity as soon as possible. Initial treatment of a low back pain is based on the assumption that pain in about 90% of the people will go away on its own in about a month. That is why doctors usually won't do investigations when the person comes to the clinic with a back pain. They will prescribe some medications and advise to take a rest. Coming to the medications. Usually we prescribe painkiller tablets. Muscle relaxants have got a very limited role in the back pain. Bed rest. Bed rest remains of unproven value, and most experts recommend no more than 2 days of bed rest or decreased activity. Some people with a sciatica may benefit from 2 to 4 days of rest. Application of local ice and heat provide relief for some people and should be tried. Paracetamol and ibuprofen are useful for controlling pain. In acute back pain, there is currently no evidence that specific back exercises are more effective in improving function and decreasing pain than other conservative therapy. In chronic pain, studies have shown a benefit to the strengthening exercises. You should try exercise in chronic pain. In acute pain, no need to do any exercise, just some pain tablets and rest for limited period are good. Surgery is seldom considered for acute pain unless sciatica or the cauda equina syndrome is present. In sciatica also, in all cases, surgery is not required. But in cauda equina, surgery is required. It is an emergency. Surgery is considered useful for people with a certain progressive nerve problems caused by herniated discs. Patients may require surgery in case of tumor, infection or trauma, but not all cases of trauma or infection or tumor require surgery. Prognosis. Up to 90% of people experience an episode of back pain without other health concerns, and their symptoms will go away on their own within a month. For about half, back pain may return. That means 50% of the people will get back pain again. The prognosis for people with acute back pain associated with the red flag depends on underlying cause of the pain. About 80% of people with a sciatica will eventually recover, with or without surgery. The recovery period is much longer than for uncomplicated acute back pain.